Welcome to the Stroke World Cup 2026, where countries go head-to-head to see who tackles stroke the best, to prevention treatment, rehab, population impact, healthcare access, and outcomes. Saturday, June 27th has an amazing lineup of countries facing off in their groups on who will make it to the knockout rounds, with teams already qualifying. Panama enters this matchup with stroke as one of its major non-communicable disease burdens. WHO-derived 2020 data lists 2006 stroke deaths, making up 11.43% of all deaths, with an age-adjusted stroke death rate of 40.58 per 100,000. Panama enters this matchup with stroke as one of its major non-communicable disease burdens. WHO-derived 2020 data lists 2006 stroke deaths, making up 11.43% of all deaths, with an age-adjusted stroke death rate of 40.58 per 100,000. The England story is not just lower adjusted mortality. NHS England says around 85,000 people have a stroke in England each year, and the national plan focuses on better rehab, expanding thrombectomy, and doubling thrombolysis access. So this matchup is about two different fights. Panama's story is reducing stroke burden through prevention, blood pressure control, and emergency access. England's story is a mature stroke system still trying to speed up specialist care, rehab reviews, thrombolysis, and thrombectomy. Croatia's stroke profile looks like an aging European system. WHO-derived 2020 data lists 6,075 stroke deaths, equal to 13.84% of all deaths, with an age-adjusted stroke death rate of 52.82 per 100,000. Ghana's burden is heavier by adjusted mortality. WHO-derived 2020 data lists 15,163 stroke deaths, 8.67% of all deaths, and an age-adjusted stroke death rate of 124.02 per 100,000. In that dataset, stroke is listed as Ghana's leading cause of death. The Ghana care story is urgent. A Ghana acute stroke care review reported 1 month in hospital case fatality as high as 41 to 43%, and a 30-year admission study found 28-day mortality of 41.1%. Croatia's challenge is managing stroke in an older population with long-term disability and rehab needs. Ghana's challenge is sharper: prevention, emergency arrival, acute stroke services, CT access, specialist care, and rehab after discharge. Colombia's stroke story is about building a faster care chain. A Colombian stroke care paper reports annual stroke incidents around 88.9 per 100,000, higher in men at 118.7 per 100,000, and women at 61.8 per 100,000. Colombia's WHO-derived 2020 data lists 16,573 stroke deaths, 8.07% of all deaths, and an age-adjusted stroke death rate of 29.57 per 100,000. But the treatment gap matters too. One registry reported IV thrombolysis in only 0.6% of cases. Portugal has a smaller population, but a major stroke burden inside an aging European system. WHO-derived 2020 data lists 12,339 stroke deaths, 13.55% of all deaths, and an age-adjusted stroke death rate of 34.68 per 100,000. This comparison is not just mortality. Colombia's story is closing gaps in ambulance routing, CT imaging, stroke team activation, and clot-busting treatment. Portugal's story is sustaining acute stroke care and rehabilitation as an older population creates more recovery demand. DR Congo's stroke burden is severe and access-driven. WHO-derived 2020 data lists 36,596 stroke deaths, 5.56% of all deaths, and an age-adjusted stroke death rate of 112.53 per 100,000. The care system story in Kinshasa shows the real gap. A 2024 stroke network project said no hospital in Kinshasa was currently able to admit and treat stroke patients according to international guidelines. That Kinshasa project is trying to build the missing chain: ambulance services, an emergency room stroke team, a stroke unit, an outpatient clinic, and prevention activities. That is exactly what stroke systems need before advanced treatment becomes routine. Uzbekistan also has a high stroke mortality signal. WHO-derived 2020 data lists 21,534 stroke deaths, 13.34% of all deaths, and an age-adjusted stroke death rate of 103.48 per 100,000. This matchup is about system visibility. DR Congo has severe access barriers, but visible stroke network building in Kinshasa. Uzbekistan's data shows a heavy mortality burden, but publicly available acute stroke pathway data is harder to find. Algeria's stroke burden is high. WHO-derived 2020 data lists 23,393 stroke deaths, 12.63% of all deaths, and an age-adjusted stroke death rate of 66.29 per 100,000. A regional study from Blida, Algeria, found 28-day stroke case fatality of 22.1%. That matters because case fatality tells a different story than death counts. It reflects how dangerous stroke remains after someone reaches care. Austria's stroke system is much more registry-driven. WHO-derived 2020 data lists 5,208 stroke deaths, 7.16% of deaths, and an age-adjusted stroke death rate of 19.61 per 100,000. Austria also has a national stroke unit registry. The Austrian Stroke Unit Registry covers 39 stroke units and tracks stroke unit admissions, acute treatment, risk factors, outcomes, and follow-up after ischemic stroke. The story here is coverage versus maturity. Algeria's fight is reducing regional gaps, getting people to CT and stroke care faster, and expanding rehab access. Austria's fight is maintaining a coordinated, audited stroke unit network with thrombolysis and thrombectomy pathways. Jordan's stroke burden is closely tied to cardiovascular risk. WHO-derived 20-day data lists 2,908 stroke deaths, 11.14% of all deaths, and an age-adjusted stroke death rate of 62.96 per 100,000. Jordanian stroke research describes stroke as the country's second leading non-communicable cause of death, behind ischemic heart disease. It also points to hypertension, diabetes, smoking, hyperlipidemia, and age as key risk factors. Jordan's rehab story matters. A community rehabilitation study found unmet needs after stroke, including limited occupational therapy availability, insufficient therapy intensity, and weak medical support after discharge. Argentina has a larger absolute burden, but a lower adjusted stroke death rate. WHO-derived 2020 data lists 20,878 stroke deaths, 8.27% of all deaths, and an age-adjusted stroke death rate of 36.50 per 100,000. Argentina's stroke story is system building across provinces. Research has documented first-ever stroke and TIA incidents, while Neuquén became an example of local stroke law organization. Jordan's story is NCD prevention plus rehab access. Argentina's is scaling coordinated stroke care across a large country.